The Digital Healthcare Experience presents The Next Breakthrough, a series of bonus episodes where we showcase entrepreneurs and pioneering voices on the leading edge, driving visionary innovation in healthcare. Let's go.
Hello and welcome to the Digital Healthcare Experience podcast presented by Telehealth. I'm your host, Chris Civitaris, and today I'm joined by Loughlin, founder and CEO of Nurse Disrupted. Bree is an entrepreneur, global healthcare IT expert, national speaker, and if I do say so, a healthcare game changer. She's been in nursing for over 20 years, starting at the bedside and evolving to a nurse executive at one of the biggest healthcare software companies in the world before starting Nurse Disrupted. Welcome to the podcast, Bree. It's a real pleasure to have you here today.
Thanks, Chris. I'm excited to be here.
All right, let's start. Can you give everybody an overview of what Nurse Disrupted is and sort of your journey from a nurse to a nurse entrepreneur and what led you to create Nurse Disrupted?
Oh, I love telling stories. So we'll start off with what Nurse Disrupted is. We're a software company out of Madison, Wisconsin. We're a virtual nursing company. I launched in 2020. We're in Madison, Wisconsin for good reason. I actually grew up in Seattle, but I was brought out to Madison, Wisconsin in 2012 to join Epic's clinical informatics team. And I absolutely loved my time there from 2012 to 2020. That's where I got to really travel the world and work with health systems with different perspectives on their EHR optimization strategies. One of the products that I managed is called Rover. It's a mobile application for nursing documentation. And one of the products that I launched is called LDA Avatar, which is a design strategy that I still am laser focused on. It's the simplification and gamification of nursing documentation. So Nurse Disrupted is a virtual nursing platform. It's one that we launched in 2020 in homeless shelters. So it's pretty wild. Our first clinics were like utility trailers in the back of churches that had like no power, no network connectivity, low budgets and an evolving staff. We also wound up being the platform that nursing students across Wisconsin would use to provide care as virtual nurses. So if you know anything about Wisconsin, there's, the lower part of the state that is, closer to Chicago. Some people just know Chicago. And I'm like, well, go north 2.5 hours, it's in Illinois. But northern Wisconsin, internet connectivity bandwidth for the nursing students is something that we had to design. So 2020, Nurse Disrupted launches. I had a ton of talented friends who, our first software developer was very well versed in this field, and we knew that our platform, our virtual nursing platform, would have to be very network efficient and of very usable design. I tell this story all the time. Our first design for the patients that were working with the telehealth platform, I had 4 buttons, and let me tell you, coming from Epic, I thought that it couldn't get any simpler than that. But in looking at the way people were using the software, I realized it was 3 buttons too many. So we designed for the humans. In 2022, the pandemic was wearing on, and we continued to expand to homeless shelters across the United States. We wound up connecting over 400 nurses with 42,000 encounters, and the patients were people experiencing homelessness. But by then, a leader of innovation for Bonds Care Mercy Health in 2022 said, listen, Bree, the nursing shortage, it's gone from bad to worse. Can we bring this into the inpatient setting? And virtual nursing really started exploding around that time in the inpatient space. Hospitals were becoming open-minded to different care delivery models for nursing. And so we took our platform in-house in 2022 or into the hospital for patients admitted in acute care. And let me tell you, when you design a virtual nursing platform to work in the most impossible situations and you put it into a hospital, it's like rocket fuel. It was so fun. We're Nurse Built, very proud of that. We work with our organizations to enhance the virtual nursing platform, and we've been growing in the inpatient space from there. So we're a virtual nursing software company. We do a little bit of hardware, but can be hardware agnostic. We connect providers to people experiencing homelessness and people in underserved communities. That's one piece of virtual nursing that we do. And then across the continuum on the other side, we also provide a virtual nursing platform that works for patients who are admitted into hospitals.
It's really interesting. And I have to say, I first came across Nurse Disrupted when you were on the Today Show. And as a bit of a fanboy of the Today Show, I have to ask, what was that experience like? I mean, was that a pretty cool experience to be able to meet some of those folks associated with the show?
It was amazing. And my parents are waiting for the episode. Like they're such big fans. But more importantly, a couple of things were happening in getting that opportunity. It was such an honor to have NBC and Morgan Radford, the journalist, feel like this was a story they wanted to tell to the world. That's also a product of, it's almost a movement, Chris, of nurse-led and nursing entrepreneurship. And big companies like Johnson & Johnson. Johnson & Johnson has this nursing innovation arm, but we're hearing it across the health tech industries where people with nursing backgrounds, and I still am a nurse, I think that running a company and being a nurse entrepreneur is absolutely nursing, but there is this energy and momentum for big companies like Johnson & Johnson, national associations like the American Nursing Association, but even VCs have been interested in investing in nurse-led products and nurse-led startups. So HealthX Ventures is our lead venture capital firm. And Mark Bakken wanted to find a nurse. You know, he does a great job investing in minority-led companies and was very interested in having a nurse-led company. We're seeing this. We're seeing this momentum happening. So the Today Show was not only exciting because they are famous and incredible, but it was also exciting because it felt and continues to feel like this moment for nursing entrepreneurship and nurse-led technology to really grow in a fantastic way. We were that day, the day that it would air at, I think it was 9 a.m. in all 4 time zones. And so my team, it was so fun. We were sitting around the table and watching our website when it would air in each time zone. And, you know, national press like that, you know, it just, our website numbers were spiking and our socials were spiking. And, you know, so what the Today Show team and the NBC team did for us was incredible. And it just helped us with, you know, a bunch more momentum from that point on. The other thing I love too, you know, they really focused on our work in homeless shelters. And I think that that's right. It is, I'll go there. Getting healthcare and resources to people experiencing homelessness and housing instability in your community. I do this for my own reasons, but there's an economic play. So however you feel about, you know, what's happening with people experiencing housing instability in your community, when you do get the right resources to them, the actual total spend in your community goes way down. Emergency department utilization goes down. EMS, we work a lot with our fire departments and our police departments. And then the amount of time people are in the state of homelessness winds up shrinking when you can give them a little bit of breath and access to care. So I'm so glad that they highlighted that piece of what Nurse Disrupted does with virtual nursing.
Yeah, it's really powerful, the work that you're doing and the way that it affects access to healthcare and healthcare professionals for, you know, groups of people who struggle with it, be it, you know, folks that are experiencing homelessness, be it in the rural, you know, setting. And I really love and connected with what you said about, you know, investors and you know, people sort of across the spectrum seeking out businesses that are owned by nurses. I've always said that, you know, it's you know, nurses really truly kind of make the healthcare ecosystem work. Doctors are phenomenal and all go right down the list. But you know, what you all have done for years and years and years and years, it's really incredible. And I think that when the pandemic, you know, sort of took hold, there was this moment where there was a bit of recognition in terms of the you know, hardships and so on and so forth. But then sort of coming out of it, you know, now we're in this situation where nursing shortages are certainly a thing that's going to be a thing for some time. We've heard so much about nurse burnout. We've heard so much about, you know, provider burnout. And Nurse Disrupted seems as though it could be a major advantage, a major player in terms of addressing some of those things in terms of shortages and burnout. Curious what your perspective is on that.
Yeah, I mean, nursing burnout is something always on my mind. It's informed every piece of my practice. I was a kidney and liver transplant nurse, and I burned out myself. There was the day where I pulled up to the hospital to go and start my shift that I loved, and I couldn't open the door. And it was a really dark moment. But that has fueled my career in saying, we need to create true change. And another love of mine is technology. I think that we can elevate the human condition through good technology design, but there's bad technology design, there's good technology design. And I've been so committed in thinking about, throughout my career at Sutter Health, at University of Washington Medical Center, but then at Epic and working with developers and now with, my own company, thinking of these problems and making it the fuel for my passion to make a better today and a better tomorrow. So the, nurse disrupted and virtual nursing, the economics of that is, when the care delivery model that we truly support, although we do have some health systems doing a little bit different, but what we really encourage is let your nurses work a 4-hour shift from home. There's a nursing shortage. It's getting worse. It's actually accelerating. There was a nursing shortage back when I started practicing 26 years ago. It's worse now. But nurses have asked for 3 things: reasonable, safe workloads for them and for their patients, flexible shifts, and an innovative career pathway. So when we go live, in hospitals, for instance, the strategy that I really work with leadership on is let your nurses work from home. You've let your physicians work from home for 10 years. Let go of your status quo and these old ways of thinking. I guarantee you nurses are crushing it, working these 4-hour shifts from home. Then let's stay laser focused on the cash. When we look at the nursing shortage, the reason hospital systems today are trying to increase patient ratios. So when I'm a nurse, I will come into a med-surg unit and there will be this kind of benchmark where it's like, hey, on our med-surg unit, most of the nurses are going to get around 4 patients. There's economic pressure on hospitals to say, can we give nurses 6 patients? And when you see, like in California, nurses strike against AI, some companies are promising that nurses can take these big workloads. At Nurse Disrupted, we stay laser focused on the cash. When I come into a health system, I'm like, I want to be best friends with your CFO because we can actually look at nursing with this care delivery model along with the technology as revenue generating and cost containing. And if we're generating revenue, a couple cool things happen. Ratios are about revenue. There's a lot of pressure. I mean, I've kind of been talking to, nurse executives right now, and they're having, huge moral distress right now because they're trying to protect their nurses. They're seeing the economic crisis of the hospitals and they're trying to bridge it. And so Nurse Disrupted, yes, it's brilliant technology. I mean, I put together the dream team across my career for software, for implementation, and for services. But the best design technology, if you just have it arrive in a box, for most places, it will stay in the box. And so the workflow, like the expertise that we bring to the table with our health systems, now 4 years of doing virtual nursing and saying, okay, we know it doesn't work, we know it does work, but also saying, look, we're doing this for a lot of different reasons, but you need to generate revenue, so you're funding your virtual nursing program, and you can have more nurses working from home. 85% of nurses surveyed, if you say, will you take an extra 4-hour shift from home? Say, yeah, I'll take an extra shift. So the first strategy is, yep, you don't have enough nurses, but your nurses will work an extra 4 hours a week if you allow them to practice in this way. Then we start getting callbacks. Nurses, when they learn that our customers are doing this, it's been so fun because the phone calls start coming in and saying, if you're going to be allowing us to practice in this way, we want to come back. And that becomes exciting. So you wind up using it as a recruitment and retention strategy for nurses as you're working in this market. And then finally, recapturing our intellectual capital in nursing. So most of us in nursing are, above 50. A lot of nurses retired. They couldn't take the physical wear and tear. And virtual nursing, one of my first virtual nursing nurses was actually my godmother. If I get this wrong, she's going to kill me. She's 80 this year. So she was 76 when the pandemic hit, she's like, Bree, I'm not done. I want to help. I see the pandemic. And she was able to be a fantastic virtual nurse. And not only that, but help train 400 nursing students who are in danger of not graduating from their schools of nursing because their practicum sites, practicum is the hands-on work that we need to do as nursing students in order to graduate. But that she was able to train 400 nurses across 9 schools of nursing. So recapturing people who have left our profession is the third thing that is happening, and why virtual nursing, the way we do it, we've got to be careful. People are using the word virtual nursing everywhere. It is hot. You will hear, of course, AI everywhere, but right under it, at HIMSS, at all of these conferences, you're hearing virtual nursing. It is not the same. Think of it as tools. Some people use sitting, right? That's not for registered nurses. Some people are trying to use predictive models to, draw your attention this way and that. We're talking about, acute, episodic video encounters with nurses. Yes, we have some places working from command centers. We really encourage people to get from home. So American Nurses Association is doing the work to try and better define virtual nursing so that it's not this blanket phrase, that it is very much more specific. And I'm happy to work with anyone on that too. I'm working on also defining, what are these different virtual nursing models and what is the right choice for you? Because it's not, a rural hospital with 25 beds is going to have, a very different need than, a large whale or an academic that has, budget and, IT staff and developers. So, happy to help people also select the right flavor of virtual nursing and help understand the definitions of the different modalities of it. I took that and ran with it, Chris. I don't even know if I answered your question now. I just went with it.
Absolutely.
Okay.
Yeah, and what I picked up on a few things, but really kind of core to sort of where I think Nurse Disrupted is so unique and sort of on target. I think you mentioned it, right? That the industry is moving towards how can technology, AI, so on and so forth, machine learning, Gen AI, replace, right, or augment human beings in sort of the healthcare ecosystem. And I think sort of sitting from afar, my perspective is that you run the risk of making, healthcare a little bit less human. And what I really love about Nurse Disrupted is that it is the exact opposite. You're using the technology to really make healthcare more human, to connect patients more deeply to an individual on the other side that has a passion, right, to help them find the right place for care, to help them navigate potentially really kind of trying times.
Yeah.
So that sort of strikes me, and I'm sure that was done purposefully, but I'm curious if you can just kind of give me your thoughts on that.
Oh, yeah. I mean, Nurseville, not with us, without us. I mean, you've got to, it's one thing to be in a room and you work with digital strategies, and it's like you can design, but until you put it in the hands of the people that have to use it, you have uninformed design. So I love agile, iterative approaches to design. And I love nurses seeing their feedback incorporated then in our technology. One of the funnest things in working with a startup as opposed to a legacy company, and the reason I went to startup world is that I needed to move faster. I needed to be able to turn out the technology and get these iterative adjustments faster so that we could get people across the finish line with virtual nursing models, but not for us, without us. You've got to have a nurse at the table. I mean, anything that you're doing, if you're going to do it for nurses, then we're going to invite some nurses to the table and say, what do you think about this? And you will be surprised. I mean, just like I learned, with our user interface, where all I can think of are things that I want to add. And when the users are giving us feedback, they're like, Bree, actually, we don't want to add that. I mean, our telehealth portal is a really good example. I had a robotics engineer from Carnegie Mellon. We kept trying to add. And the nurses are like, keep it lightweight. I need to get it close to my patient. I need it to go around IV poles. Okay, great. I'm trying to use these things that you're adding, but when you listen to us in the way that we need to use things, this is what actually works. And it's a humble way also of developing, because it's not all these great ideas that you spin out. You're like, holy cow, I can make like this, amazing futuristic device. It's actually building in context with what will lift workload and what will actually solve the problem, and being very frank on like, I designed this feature, what do you think of it? And if the answer is it does not help me, listen, and that's hard. I mean, developers really hang their hat on the products they design. They want to see it win. They want to see it in the product. It's how their bonus structure is. So, when you're deploying the technology, I mean, one, you have to have a nurse at the table. Look at your patients too, anyone who's using it, and have some kind of methodology on getting the feedback. Technology is moving at such an accelerated pace. ChatGPT had the major breakthrough in November of 2022. We are not even 2 years into it. And so also as I'm looking at the pace of innovation, bringing, this nursing shortage, problem and putting that at the center, something that I think is important, and Chris, I'm curious on your point of view on this, but the big thing is things are moving too fast for you to have an idea that technology is permanent. Any solution that you are purchasing that you're thinking of hardwiring in, you're like, I want something permanent. It doesn't exist in this reality right now where we've had this crazy catalyst on the acceleration of the development of technology. Nurse Disrupted keeps fluid. So we're working with really fun companies. There's one that just emerged called Vital Audio. They do digital audio biomarkers where you can get physiologic values through audio feeds and really low quality audio feeds. And so the ability to bring in these, awesome developments and stay fluid and agile in the hospital room is another design principle that I think is very important as people accelerate to the hospital of the future. Anything you install today, if you make it permanent or wired, you are going to be out of date by the time you get into your hospital. So how can you create an environment where you can evolve your technology as fast, as the innovations are coming out? If we
I think it's a great observation. Yeah.
The hot AI topic, there is a place. AI is, again, a general term like virtual nursing is. People should be saying tool. It is a tool. What problem are you solving? How are you solving it? And is it accepted by your end users? And so, when I think of our technology and the trust and getting over the barrier of workforce transformation and such, and then the acceleration and the maturity of the regulation of AI tools that are created, the maturity of the tool and the problem it solves, that our ecosystem has the ability to introduce those tools, even of legacy companies. I mean, every legacy, big company is putting their thousands of developers towards maturing these technologies, and it's our job to be able to facilitate that. And also as a nurse-built, nurse-informed company, make sure that the way that we're partnering with people is accepted by nursing, nurse-informed, and nurse-trusted.
I think that's exactly right. I mean, and I think, I had a CIO tell me sort of in the beginning stages of the AI revolution, to your point, shortly after, ChatGPT really exploded in 2022. He said there's going to be, big AI and kind of small AI. And the big AI is going to be, the large language models and so on and so forth. But then what's really going to, in a lot of ways drive healthcare is the way that people take that big AI and apply it to real world, problems that are at the bedside, real world problems, in terms of, the big, macro issues that we're dealing with in terms of the staffing shortages, in terms of access, in terms of, health literacy, health equity. We've certainly tried to sort of, hone in on that. And it really sounds like that's sort of your mission too, that you have this wonderful domain expertise in terms of, where the healthcare ecosystem has challenges with access, where we have challenges with equity. And you're bringing, technology and technology that is on its surface, pretty easy and simple to use. What really strikes me, as somebody who has, done this for a little bit as well in developing technology, it's amazing how quickly you start kind of adding the bells and the whistles and what's valuable and what's not, as you sort of describe. There's so much value in that simplicity in terms of scale and making it ubiquitous. I think that is so lost sometimes as we think about all the things that, technology can do.
Yeah.
We go there. Is it good for the end user? Is it good for their constituents, the stakeholders?
Yeah, I think as software companies, we do need to shift the way that we reward, incentivize our employees. Or, it's not, and I love Craig Joseph is great. He works at Nordic and has a great book out on, human-centered design. And him and I really agree that there needs to be an incentivization of subtraction. That there has to be, when you walk into a room and you're looking at the system, to say, what is it that we can remove and take away? Because there is a lot. a lot that can be taken away. And that's, any, longstanding technology is also just general processes. But there has to be an incentivization of being like, you're brilliant. Like you just made this technology melt away. Right now it's, who can get, it's who can get, their feature in and how long lasting can their feature be. And everything's incentivizing on adding and creating something that's more complex. And so how do we change that and make the antagonist of our story, every software IT technology story, the antagonist, the people, and not the product?
It's such a microcosm of healthcare. I mean, forever it's been kind of quantity, and trying to shift towards quality. Technology, I think, really is an interesting parallel to sort of the more global dynamic about what we've been dealing with in healthcare for so long. Yeah. So it's really interesting. You mentioned several stakeholders in the conversation in terms of everything from this is what's really interesting, from CFOs to, frontline nurses, nursing students, obviously the patients sort of at the center of everything. What's your strategy? How do you get all of those really diverse stakeholders on the same page in terms of implementing this and making a difference in in the patients' lives and sort of in their own life? It's just such a diverse cross section. How do you manage that?
One thing comes to mind. It comes out of cash. So, there's this. You have so many stakeholders. So I've worked with 9 out of 10 schools of nursing. I have to work with state legislators. I work with community sites like homeless shelters. I've worked with payers and had contracts with payers. I work with health systems, but at the table you have operations, you have IT, you have finance. These are the three people where I'm like, we can't do anything without them. We have our workforce, our nurses, our associations, right? And there are different motivators across the different people that we bring together. A couple of things have come up lately, and it does come back to Morgan Radford's statement from the Today Show piece, and she says, why hasn't anyone thought of this before? And what's incredible is that we overestimate what has been done. And when you have an idea, I found that if I hash it out and say, well, it could work in this way, this way, and this way, and do a full end-to-end design, pull the right team players together, just an ACE team where it's like, okay, I know this group can get it done. Here's the design. Here's the people that we need to pull into the room. That end-to-end design and the willingness to identify who could actually make a project get across the finish line, when you bring them into the room, you find out a couple of things, like the infrastructure that maybe you thought would have been there isn't there. It comes down to you. So, I think that understanding who and thinking like I call it wargaming out, right? The 80s movie where you're doing X's and O's, right? And you're
one of my favorites, absolutely.
Wargaming it out, and who needs to be at the table. And it is amazing that when you are truly solving a problem, right? I mean, going back to the shelters, people needed care. And then I had an elected position with Wisconsin Nurses Association, the Workforce Advocacy Group, right there in the involvement in our communities and the involvement in our tech community as well as our nursing community. People were coming to me like Kim Loughlin, the associate dean at the time for Marian University, saying, Brie, I have 9 nurse practitioner students who will not graduate when we needed our nurses the most. Can you do something about it? And then just saying, yes, and then I'll figure it out. And then pulling people together who are really talented to figure it out. I don't know if that answers your question, but
yeah, and you've really found a way to, kind of have a deep understanding of how you're creating and kind of capturing value across all of these different stakeholders. And you're doing it in a way that is, again, at the end of the day, making a difference in people's lives who maybe otherwise would have been in kind of a bad way.
Yeah.
So it's really, really interesting. I'm really curious where you see the future of virtual nursing going. Obviously, as you mentioned, there's sort of at the baseline level needing to define sort of what the different elements and variations of virtual nursing will be. But from your lens, where are we going in the coming years as the technology evolves, as the needs of patients and the healthcare ecosystem evolves? What do you think is next for the space?
I mean, first, we need to survive the hype cycle and stabilize. So this is a workforce solution that must be defined, that absolutely for any technologies in nursing, if we're going to grow our nursing workforce, you have to, it's so interesting how I like Tom Lowry. He speaks a lot about, AI, which is, different than what we're doing. My job is to keep fluid so that we can pull in these different applications, whether Epic's making it, whether Microsoft's making it, whether a cool startup like Vinyl Audio is making it, that our platform is able to leverage, these awesome technologies, but we have to keep problem focused. We have a nursing shortage. It is global. The global nursing shortage is massive. We must keep laser focused on the problem. And if nurses say, this is not an acceptable piece of technology solving my problem, that the tech companies and people providing the solutions must listen. Because even if you can get a CEO to purchase the product and pay for it, if they have not designed with us and only for us, you're going to see things like in California. So I think the messaging needs to be national. I know AONL is really working on getting this national message out and hearing this more in HIMSS. Like, we've got to change the way all of our healthcare leaders and our technology leaders think. I think that, a really good example does go back to the homeless shelters. Nobody would have started a startup company, that was not a non-for-profit for underserved people, and saying, listen, I'm going to change why people create technology, right? Nurse Disrupted needs to crush it and be successful financially, because people will design for a different reason when, as we continue to grow and succeed. I'm not answering your question specifically on where virtual nursing is going. It must go global. It must. There's not a country. All of England went on strike last year. The Prime Minister was involved. I've never seen a whole country strike. I've seen a lot of people strike, but I've never seen a whole country strike. So, for us, we definitely are working with global partners, first world countries, really looking into getting to third world countries, because the international nursing shortage, people used to go to third world countries and recruit nurses into the United States. They're not there anymore, and virtual nursing must be a global strategy. It must evolve at the pace of technology. What we see as virtual nursing today, we must be looking forward and collaborating with lots of different, vendors, software shops, futurists, and working at the elbow with a problem-focused approach to say, okay, once we get, hospital throughput is one of the, big things. Once we reattract nurses to virtual nursing, academics, I'm working with more. In the beginning, I worked with 9 schools of nursing, but now I'm having deans of school of nursing at University of Washington. I'm so excited we're starting to have these conversations on putting nurse entrepreneurship and virtual nursing and nursing innovation. They've got a great interim dean, Allison Weeble, who has put this digital, I'm going to mess up the name and she's going to kill me, but it's the Digital Innovation Hub at University of Washington. And her vision is nursing innovation, nursing-led technology, and actually putting a program with four schools at the university. It's School of Nursing, School of Medicine, School of Engineering, and School of Business, and saying this is nursing. Designing these products are nursing. And so, I'm so excited to know that virtual nursing is becoming nursing. There's a day that maybe we won't have to say virtual nursing. It is just part of practice. And that the academics are saying, yes, we do need to fold this into our program. So virtual nursing is nursing. It's becoming accepted. It's being put into the schools of nursing. I'm so excited to be helping people out in that. Virtual nursing is a global strategy. It must be. The shortage is global, and no country's gonna, we're not gonna get better unless we really see, how we can expand this and stay problem focused. Okay, here is a cool technology. What problem does it solve? And are your nurses or your workforce responding to it in the way that you expected it to? And then the acceleration of technology. Are we creating this network where we can say, digital audio biomarkers are coming to play, along with, what Epic's fantastic, 4,000, 5,000 developers, are using that big pot and gold mine of data, to get across the finish line of machine learning. Do we understand the ecosystem of technologies so we can put, the dots together and come up with these problem-solving solutions? I think working together in collaboration, we also have to do that because of how fast things are going. No one dev shop is going to be a catch-all solution. I love like what you were talking about with all of the players, where it's like, how did we do this with all of the different people at the table? I think we have to continually educate ourselves as, leaders of tech company and people evolving technology on what is emerging in technology and how we can meet together and work together on, an elevated product. And, that's different than merger and acquisition. That's true partnership and collaboration. It's something that I'm working towards, and I know elevates our technology and our ability to pace quickly.
It's so cool. I'm so happy to hear that academia has also recognized that there's sort of a Venn diagram of, a business, IT, the clinical aspect of nursing, medicine, so on and so forth. I think that was such a missing piece of the puzzle for so long, where, folks that got into practice sort of had to pick it up on their own.
Right.
So the fact that we're starting to hear that there's some purposeful, evolution towards that space is pretty encouraging.
Yeah. It's exciting, huh? Yeah. Are you seeing it? Are you seeing more startups coming into the space, or what's the scoop? I feel like 2024 might be, a really good opening for, startups because of the pace of innovation. But what are you seeing?
Yeah, I think so. I mean, I think, the startup world has obviously since, 2019, 2020 cooled a little bit. Interest rates haven't helped. There's been a little bit of a pullback in terms of the investment there. But at the end of the day, I think any time in, the history of the world, when there's been technology that is truly, disruptive isn't even the right word to use for AI and machine learning. It is truly revolutionary. So I think that, over the next, 5 to 10 years, we're going to start seeing another uptick in the startup world and the communities around healthcare, where we have, folks like you with a really deep domain expertise of what patients need, what providers need, how it connects to, the cash, the rev cycle sort of side of things, how it connects to the community side of things. I think all of that expertise is out there. And I'm optimistic, I guess. This is the optimist in me. I'm optimistic that more people will be sort of stepping out of the shadows to bring the ideas that they have to the broader community. And those investments are going to start to be made at an accelerated pace, because what other choice does the industry have, right? We have to leverage. It's such a tight-knit community. While healthcare is, 23% of GDP, whatever it is these days, it's still kind of a tight-knit community. And the people in healthcare are kind of, in my mind, going to be the ones that shove it forward. And we need more nurses. We need more physicians stepping into this world and making those connection points between business, technology, the clinical side, the patient. I don't know that we're going to be able to have the results that we need to as a society without that. So I'm hopeful.
Oh, I'm with you. I'm seeing the message. So let's just keep it going.
That's exactly right. We'll all do our part, right?
I like it.
Anything else that you want to share with our community before we close?
Everything. I mean, it's so hard to get. We'll land the plane. So, I'm so excited to talk to you, Chris. And I think it's a great time. I am excited to be a nurse-led company. I am very excited that leaders of health systems and investors are excited for nurse-led technology and entrepreneurship. And yeah, thank you for this opportunity.
It was awesome. And give me one more thing, Bree. If people want to learn more about Nurse Disrupted, where can they go to find you? NurseDisrupted.com, a great place to reach out. We will reach back out to you. I'm super easy to find on LinkedIn, so that's probably the second easiest place to find me, and then the company at our website, NurseDisrupted.com. Bree Loughlin from Nurse Disrupted, thank you so much for joining us today, Bree. It was just really awesome to have you on. And I hope that you'll come back and keep us posted on the progress that you all make with the program and the solution and the company. It's just such good work that is so valuable. And we wish you all the best. And please, we hope that you'll come back and visit again.
Great. I'd love to. So I'll see you soon.
Outstanding. Okay. And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's it for today. And until next time, this is Chris Civitaris wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer, podcast music by Nicholas Bach.